COVID policy seems to be as inconsistent as ever. The vaccine mandates continue to be a political football. Some airlines are allowing unvaccinated employees to return to work. But the city of Chicago continues to push a mandate for police officers and other first responders. In addition, the New York City mayor prohibited an unvaccinated NBA player for the home team Brooklyn Nets from playing games in New York City, even as unvaccinated players for visiting teams are allowed to suit up and play. Meanwhile, the CDC recently published a paper touting the effectiveness of mRNA vaccines, despite legitimate concerns that nearly 8% of vaccine recipients experience adverse events. Here to unpack all of it is Dr. Andrew Bostom, academic clinical trialist, epidemiologist, and research physician. Dr. Bostom, welcome back to the program.
Hi, Joseph.
Now, tell us, from your perspective, Ukraine seems to have knocked a lot of COVID off the headlines, but where do we stand now with COVID?
Well, we're in good position in the United States. The Omicron wave, even with the sub variant, the 2 variant, is still waning. It was a much milder wave in many respects than the previous waves in terms of serious morbidity and mortality. And it's probably conferring a lot of natural immunity to the population. The Kyrie Irving situation with the Nets, I grew up in New York, is particularly ironic, Joseph, because he was in attendance. He bought a courtside seat I think basically to show how absurd the policy was. And as you pointed out, unvaccinated players, as long as they weren't a net, could play in the Barclay Arena. And afterwards, Kevin Durant participated in a presser where he just was shaking his head at how absurd the policy had become. So it's good when an athlete of Kevin Durant's stature, or Kyrie Irving's stature, start to point out or make gestures that show how absurd these policies are.
That particular case does seem to illustrate very well the absurdity of this. And it's very difficult to make the case that there is a public health justification for saying, oh, well, you play for the Celtics, so you can play, but you play for the Nets, so you can't play. There's clearly something else going on there. We are still seeing something of a patchwork of COVID policy across jurisdictions. For the most part, across the country, schools are now meeting mask-free. Do you believe that the change in policy is a reflection of the fact that the numbers really have changed in terms of positive cases, in terms of the death rate? Or is this something where the politicians are now kind of catching up with the public fatigue over COVID?
I think it's mostly the latter. And I also think that the public has seen through really a lot of the pseudoscience that was behind these regulations. It's slowly coming even to public awareness that the non-pharmaceutical interventions, whether they were imposed rigorously or not, had very little impact on the epidemic curve, had very little impact on morbidity and mortality, and came at a great cost, both sociologically and economically. And this is particularly apparent now to parents who have been advocating for their children not to wear masks, not to have healthy children be subjected to vaccine mandates. So I think that's been the driving force behind this. But yet, there's a lot of recalcitrant forces that are spouting the same things that have been disproven. And then also, I did want to mention, Joseph, you brought up at least I was sent the Lancet paper, which was part of the CDC analysis of vaccine safety, CDC FDA analysis, and it's only covered 6 months worth of follow-up for the COVID-19 vaccines, and in particular the most commonly used in this country, the mRNA vaccines. And I just did a quick tabulation. just to give you and your audience a perspective. So remember, it's 6 months of follow-up for the mRNA vaccines. Well, I compared that in the same system. We have this passive system called the Vaccine Adverse Event Reporting System, or VAERS, which, by the way, we now got documents from Pfizer that were part of discovery in a trial. And Pfizer acknowledged in these documents that were hidden that they relied on the VAERS system so that they wouldn't have to do the follow-up analyses for adverse events, because they claimed in these documents, at least while putting it down in public, but they claimed privately that it was quote unquote robust. So there you have it from the large vaccine manufacturer. But at any rate, if you look at 6 months follow-up in terms of deaths that had been associated with the mRNA vaccines, there were 4,496. In 20 years of flu follow-up in the same system, from 2000 through 2019, there were 688. So 688 in 20 years versus 4,496 in just 6 months, as reported in that Lancet paper. So about 7 times the rate. For stroke, it was 1,937 events associated with the mRNA vaccines in 6 months. Versus 370, so 5 times the rate, 20 years worth of flu follow-up. And same thing for myocardial infarctions, heart attacks, and this syndrome of inflammation of the heart muscle, and it's covering myopericarditis. For myocardial infarctions, 1,118 in just 6 months associated with the mRNA vaccines, 72 associated with the flu vaccines. And for myopericarditis, 1,307, again, 6 months of follow-up for the mRNA vaccines, 111 associated with 20 years worth of flu vaccines, so 13 times the rate. So I think it's useful to have these metrics out there as well.
Dr. Bostom, that's great context for the next question I have for you, because many jurisdictions are still enforcing vaccine mandates, including in Chicago, where Mayor Lightfoot there is continuing the threat of firing first responders, including police officers, if they don't get vaccinated. Here's what she had to say about that.
My goal always is to educate people into compliance, and my hope is that the vast majority of officers, majority of which are vaccinated, will come into compliance and we'll move on.
What's your reaction to this idea that we got to educate people into compliance?
Oh, I'm all for education, but it should include education that doesn't ignore this disproportionate rate of serious adverse events. And then, of course, Joseph, we have the basic question. And by the way, this applies. So I actually think the record shows that COVID-19 vaccines are significantly more dangerous than flu vaccines. And again, they're roughly equivalent in terms of the wide usage. And now we're seeing with COVID vaccines, the need for boosters, and flu vaccines are administered every year. But both suffer from a lack of ability to prevent transmission. And that's why neither one of them should be mandated. In other words, if a physician and a patient make a conscious choice that the individual is perceived to be at increased risk for serious consequences from either flu or COVID, that is a personal protection choice to get vaccinated. And that's the way it should be relegated for both of these vaccines, because it's absurd to mandate a vaccine that has never been shown to decrease transmission. And that is true now. We have 40 years of evidence for flu vaccines, and we have a little bit over a year of evidence now for COVID vaccines that neither reduce community transmission. And that would be the only ethical and scientific rationale for mandating them. Beyond that, it's a personal choice in terms of protection.
Dr. Bostom, of course, one of the things that we've needed in order to get an understanding of the impact of these vaccines is time. And time is now passing, and we are learning some things. And we hope and pray, of course, as we gain that knowledge through time, that our policy in the future will be informed by that. But Dr. Bostom, we appreciate your time very much and informing all of us about the latest developments. Appreciate it.
Thank you, Joseph. Thank you.